Okay, this is the bit where hopefully a few of you pile in from the waiting room. It's 7 o'clock, starting on the dot, mainly because that's automated. I've got my fellow speakers, the panel that are coming on after me, that are just sorting out and toggling their text, so they might pop up on screen and say hello in a second. But I'm just going to give it a little bit of time, let people join us, or kick straight off. But nice to meet you all. If I haven't already, I'm Jack Chew, and I run a company called Physio Matters, which is in the CPD education and influence space in MSK. And it seems that the topic on everyone's lips and the pressure that we've been facing to talk about the cost of living crisis and how that intersects with our world of MSK practice, particularly privately. And so we've got this piece that we're doing with MSK Partners Network, who will explain why their network may well be able to solve some of those problems, and for them to be able to discuss some of the shared experiences they've had in grappling with these issues. We are all starting to trickle in. Welcome. Let us know in the chat. So just a quick orientation then for you. First 5 minutes is the intention for me to just show you around. So you'll find two key things to look for. One is the public chat function. Kevin's just letting me know on there that some people on the MSKPN chat are struggling to find a link. They were emailed if they registered. If they didn't register, they won't have necessarily got the link. But if they go to the place which you register, that usually redirects them here, and there shouldn't be any barriers to entry. It should just be to put your email in. So if you've got any friends texting you, asking about how you get in and stuff, it should just be on that one URL, which, if possible, someone could post on on the chat. Then people can share that back and forth to their friends or WhatsApp groups if they need to. But the public chat is where obviously we can put anything you like. If you've got any specific questions, you're better off putting it into the Q&A tab, which is slightly separate. And if I notice any questions that come in there, I'll move them into the Q&A tab. So it's not that I'm censoring you. It's not that anything in the chat is being deleted. Sometimes we move that over to the Q&A function because that is the place where people can upvote and downvote questions. So especially when our panel come on, we can have some questions in there that can be upvoted and downvoted, and that's why we use that function separate to the chat. Whereas on the chat, anything goes. Okay, so for example, please let me know where is it you're coming from, where are you dialing in from, where in the world, where in the country. This should be pretty UK centric. A lot of the conversation is going to be UK centric. So let me know where it is you are, where you're based, in the chat function, if you would, please. I know a lot of you, it looks like a lot of people on their phones, which is absolutely fine, of course. So welcome. And I suppose I should ask, if I can then, if you're on your phones, it usually tells me that, tell me about the circumstance I found you. Are you on your sofa? Are you multitasking? You got Game of Thrones or whatever that's called on in the background, and you're sort of dipping in and out today? That's absolutely fine, of course, but let me know where it is you are, quite literally in your house, right? What we're doing. Or are you in the home office? Is this serious enough for us to be, or are you still in clinic? Obviously, let me know. Thank you so much for those that are putting messages out. And a big shout out, of course, to my good friend and yours, Rob Bevan, who's in Cheltenham General Hospital, but he's still tuning in. So Rob's a good friend of ours, part of the Physio Matters team, but he's had some surgery. But of course, he's not missing the session because it's Rob Bevan and he's a workaholic, but don't tell his wife. Donata is from Perth, Gloucestershire, walking the dog. Hi, Joe. Angela, South London. Fantastic. So already just from those answers, we've got a decent spread and people are still arriving. So that's great. One more minute, I want to kick off. So the main thing, really, the main format which we'll go through is that I'm going to present sort of 20 minutes or so as a bit of a listening exercise, and also reflecting on the process over the last few weeks where I've been doing a listening exercise. Lots of polling, lots of questions. I interact with a lot of different clinic owners of various different stripes in different parts of the country. And I've been asking them similar questions. How is it affecting you? What are you worried about? has it come yet? Do you feel it's coming down the line? Are your patients talking about it? Those sorts of things, as well as on social media asking questions and getting some more direct answers that I was able to sort of aggregate into sort of polls and work that out. So I've got some data for us to discuss. But also, it doesn't have to be that retrospective thing that I've been doing over the last few weeks, although I will present it. I will use that as a starting off point for us to then be able to share that yourselves, using the chat function, using the Q&A function. I've got a few polls I'm going to share on here as well for you to get your views out into there. It really is going to be, especially my part of it, it's going to be enhanced by your participation. I'm not going to be one of those awkward pricks that then just, if I don't get any answers, I'm just going to sit here silently making a point. I will make sure we've got some stuff to talk about. There's plenty to talk about because there's stuff that's come up ahead of this event. However, I'm keen for you guys to participate, to help each other, and over the course of the duration of the session, I'll be presenting mainly the problems, and together we will come to solutions, which is the spirit of the Musculoskeletal Partners Network. And of course, what Physio Matters has been about for many years is providing those solutions. We don't hide from the problems. We don't try and shelter and sanitize the problems, but we do all aspire to get towards the solutions together. And so I think that's why this session, if it goes as I hope it will be in the spirit of that. And that really means that even though that's why orientating yourself to where the chat and Q&A functions are and making sure you do. If you're just listening in and you're not necessarily watching, then pick the phone up now and again to press on my polls when I put them up on screen, and that'll be brilliant. It'll be really useful. And with that data, we will all seek to try and come to solutions together. That's how it's going to work, because of course, no one's got a monopoly on good ideas, and we know that together we might have a better chance of getting through some of these bumps in the road than we would in pockets of isolation. And sometimes it can be a lonely place, especially with there's just climbing out of COVID. Let's not plunge ourselves into the depths again by this one. Okay, so tis now beyond me 5 minutes of orientation, and numbers seem to have stabilized in terms of people coming in. And so I'll just rattle through a couple of these slides then. For those that don't know me, I'm Jack Chew, and I run a number of businesses that operate as a group, but the main thing we do is we raise standards in MSK practice through a variety of different means. I have a clinic in South Manchester, a village called Timperley next to Altrincham, which is called Choose Health HQ, and that is a private practice in which we treat people with their sore bits, MSK-centric, rehab-centric practice with a gym, waiting room, clinic rooms, etc. Pretty standard. But we also, in that, have a radio studio in which we've been doing for many years podcasts and other live broadcasts. Back when it was novel, we got into podcasting and do interview-based education, which also then spun off into Therapy Live in the depths of the pandemic. We used this platform that you see before you to then do mass education when we couldn't all get together. We used to run conferences in person. We now do them virtually, and we'll be working towards a hybrid model as is appropriate. Also the founder of MSKR, which is a think tank which muses over all things that intersect between MSK and policy. Also more recently, although not relevant for tonight really, and certainly I prefer questions not in this direction, but I also stood for CSP Council recently, and I'm due to sit on their council, on the CSP Council, our CSP Council, in November of this year. And so that's me. These two in the bottom right there are affectionately known as Test and Control on the internet. They're my twin sons, Max and Eli, have certainly kept me busy whilst I was trying to bring this together today, trampling on my keyboard. And the top right there are my team. I always like putting that picture up. We'll look a little bit younger and a little less grey because that's the last big team hug we had before COVID. We have got together since then, but that picture still lingers. Okay, so enough about me. 3 sections. Listening, which is the listening exercise that I've done and we're going to be doing today. The learning is going to be a panel discussion amongst the directors of MSK Partners Network, giving examples of how they're coming towards solutions. And then the actioning part is I'm going to come back and I'm going to pick their brains and really challenge them on why is it that together we can get through this? Like, what are the examples we can draw on, or interrogate the examples that they've come to together as part of the learning portion of it, to then work us towards answers. Also, for us to then think about, right, what are the outcomes of this session? Because it's not as if, I mean, it'd be lovely if we did, but it's not as if we're pretending that we're going to solve all of this tonight in one foul swoop over an hour and a half. We're going to we're going to then work towards what are the actions we're going to take away from this and how can we move forward together. So that's the plan in 3, and that is generally in half-hour chunks, really, but I've got 20 minutes to go. So actually, before I bring that up, I'm going to use my first poll, mainly to make sure you guys know how to do it and it's working and stuff. But some of the polls are multiple choice, and some of them you can put one word or one sentence answers. But hopefully this works. What most concerns you related to the cost of living crisis at the moment? So this is one way you can put 1 or 2 words, sentence. No pressure. You're certainly not going to be judged on your responses. It's not a test. But I just wondered if you can just have a little think about what most concerns you related to the cost of living crisis at the moment. And unlike when I just put numbers up, I won't get responses coming in straight away for me to know exactly whether it's working or not. So if you haven't received, as a pop-up on your screen, you've not received that poll, then let me know. But essentially, that's my first question for you today, which is one of the questions that I've been asking. I've been asking everyone really last month or so, at least, as well as on the internet. What most concerns you? And I will, some answers coming in now, I will reflect them into the conversation. But again, the more you can engage with this, the better. And it seems it's smart for us to bring this together in these polls, because then if it's all in the chat function, it can get a bit messy. But there will be reports from this conversation. This will be recorded. We'll be using this as a start-off point for creating content and things like that as a network. So really appreciate you giving your answers. And I'm delighted to see that the answers that you're giving haven't thrown off a massive curveball from what we've found from my data in advance. I'm going to leave that open a little longer. Responses still coming in, but thank you so much. Please do keep them flowing. Really appreciate that. I'm going to leave that open a little longer. But then I'll show you this, right? So it wasn't a direct poll. I can't pretend. I mean, if any researchers listening, you'd be cringing at my methods. They weren't perfect, absolutely weren't perfect. But social media polling, as well as then me making notes and making sure I asked those questions. But those that engaged, there were 482 UK-based individuals that work in private practice. And so it's hard to know. Of course, it might have been 5 from the same clinic. We don't know that. And we don't know the geography of them as of this point. But they were sharing their thoughts on their main challenges, invited to answer that question. And then I've kind of clumped together a few of the key themes. Affordability for patients, bills, which was, in general, it was I'm going to say number 2, it says bills, but kind of means your outgoings more generally. Number 3 was staff retention, pay expectations. And then there were other smaller factors. So those 3 as categories were the main ones. And then other factors included travel, which was everything from commute to people moving between multi-sites, home visits. Second of those, having to go back on green or other ethical progress. I'll unpack what that means in a second, but I've noticed in the poll results, there's a couple of people grappling with that. And the third thing is the insurance rates and third parties. Not necessarily a new challenge, but a new manifestation of those challenges have come up. So for those that haven't answered yet, obviously you've got a bit of a spoiler alert in some ways. If you're just joining us, I've just noticed a couple have just come in. Then we're asking what's most affecting you in private practice, private MSK practice at the moment. And so thank you for contributing to that. So let me just bring in then a bit of a reflection, more subjective reflection then on this slide. So affordability for patients is one that came up obviously pretty consistently, and I think that's a concern for all of us as consumers of other things as well. You know, it's just that your pound doesn't go as far, and that's affecting everyone's sort of concern across the board. And so why wouldn't it be that our patients that might have pain and injury, that might consider seeking our services, let's just think about them as self-funders for now, that they might have to think twice about coming to see in the first place, or particularly the number of sessions, or the sharp intakes of breath when they're starting to consider what that might look like in terms of their recovery. And they're just having to be a bit more thoughtful there because they're having to tighten their belts. That's the kind of gist of it, and we'll unpack that in more detail. The second one being bills and outgoings. Apologies if you can hear my kids crying getting out of the bath. I haven't got a home office anymore. I've got converted into a nursery, so I'm afraid you're getting the amateur hour here at the Chew household, but hopefully they will quieten down soon. But bills and outgoings, that's kind of a big category, of course, and that's where I think the conversation in the panel, as well as then the other, when we bring that down and interrogate that in more detail later on, I'm excited to get into the weeds on that. But anything you might think of came up in that. And I notice in the poll that you guys have answered, electricity bills up there a few times, the utility prices more broadly, water, business rates has come up, because of course this, we're at mercy of politics in many ways to that, as well as then the big three, those big three, the staff retention, etc. So bringing it on to that was one whereby some people were relaying that they were already receiving pressure from staff. And by the way, I'm not, and no one that I was speaking to or on this call would say that is an undue pressure. No one's really mentioned to me that their staff were being unfair or any way militant. That all the business owners I spoke to, and I reflect this myself, feel really understanding of the circumstance that as an employer you should be talking to your staff about these things and are likely to receive questions in that direction. And that is reasonable. But there were also just factors where, even though it hadn't come up or that staff were reassuring clinic owners in that direction, it's still something that was preying on people's minds. Thoughtful, caring business owners that are understanding of the circumstances and well-being of their staff are going to be thinking about the fact that is something that they'd like to do. It's particularly if you have a structure in which you do give out, say, Christmas bonuses. We're moving into that time of year. Or if you're someone that have annualized calendar salary reviews, we know that it's coming at a bad time. And so it might well be, in some cases, it was that staff were already making those noises. In other occasions, it was people reflecting the fact that they know those conversations are coming or should come. And of course, it's without judgment that we say that's coming. Although, of course, I'm not pretending that there might not be some people that do take the piss and apply unfair pressure, but that certainly wasn't a major theme that came out from it as of yet. Obviously, feel free in the chat to let me know if you're receiving and on the receiving end of what you feel is an unfair part of that story. Now, when it comes to the other factors, then that was particularly a bit more interesting. They weren't as common, but they were there. The travel factors, that seemed to vary clinic to clinic, because if you've got a very local staff base, and even a very, I suppose that's affordability. I was going to say patients, how far your patients come, but let's just say local staff base, and you are a outpatient MSK clinic that it's patients to waiting room to clinic room to gym to waiting room to home, right? It's not got that home visit type domiciliary. It isn't multi-site, so your staff aren't going mid-shift between sites, in which usually classic model would be that you've got a base site, which is your majority, and then you actually do have expensible costs for travel between sites, usually. So that seemed to vary. It was massively variable, that, because some had absolutely no concern over that. Petrol prices didn't affect them at all. And then there were others that had different layers to it. Staff come far and wide, and therefore that's going to feed the staff pressure, or even a couple of clinic owners that don't live near their clinic, and that was concerning them, is that their own personal bills for travel were going to go up, and they would normally cross bill that to the business that they now know they need to keep an eye on cash flow. This was an interesting one that needs a bit more explanation, having to go back on green or other ethical progress. So this was one that I didn't see coming. Wasn't a huge one, but definitely was there, and it was a pattern. It wasn't just a one-off. There were some people that explained that they'd made some better but slightly more expensive choices, in a sense that they had gone towards, say, sustainable PPE or biodegradable wipes and the like, or they'd moved away from sort of different types of alcohol wipes and alcohol gel, and it was more expensive. Now, they'd made that decision feeling conscious of a positive environmental change that was suiting their ethics, but then were realizing that fundamentally that is something that they'd done at an expense to them that they thought they could swallow. And then this potential downtick has meant that they then feel bad having to renege on what they feel were positive choices done for the right reasons. Other examples of it were that we had a couple of clinics that had mentioned that they'd made a conscious effort to move towards, say, a more rehab-based approach. They'd stopped, say, doing routine maintenance, or they had someone mentioned that they had a couple of medical acupuncturists in that they decided that the business didn't really, it felt like it wasn't really compatible. But then they kind of felt that those were sensible decisions for where they wanted to go for growth. But fundamentally, that was income that they always thought they would be able to replace that they're now a little bit nervous on. And so they were just admitting, it was really good of them to admit that those were factors that they were feeling a bit gutted about. Now, again, when it comes to main concern, it was lower down the list, but that was just something to bear in mind. And a big one that comes up over and over again, not necessarily a new problem, but a new manifestation or challenging the problem, is this insurance rates and third parties. And so, of course, that cropped up is that whilst we can tinker with prices, we know that if, say, Bupa, AXA and the like are not going to be adjusting what they will pay us in line with anything, then that pressure only increases. That gap between our normal pricing model and the insured price model comes through, and it's hard to know as to what the rates or referral rates will be in that as well. It's a bit of an unknown. However, there might be some insights that come later. I haven't conferred with Rupert, Simon, Karen, Natasha. They may well be giving us some news on that. And of course, MSKPN have done some work on data, getting the data out there, justifying our worth and trying to raise the profile of physiotherapy within those insurers. But definitely not going to be what this session's all about. So we're not going to get too lost in that. I'm just making sure I haven't ignored. I mean, all of this won't be being ignored. It will be being amalgamated and put together as part of a reflection piece for this session. So when you contribute to these polls, if I'm not reading it out, it's because it's sort of matching on to other things I've said. My next slide comes from our friends. I know for those of you who don't know, Therapy Live in its original form was a combination between Physio Matters and HMDG, formerly Physio Digital. It's a health digital marketing group that provide marketing services for, and they specialize in MSK clinics. So they were able to, good friends of ours, and they were able to give us some insights. You can imagine that they've got some good insights because they're running all these ads and understanding analytics and tracking on websites. So they were able to give us insights from 500 clinics in the UK. New patient booking rates are down between 5 and 15%, which, as for where on that scale it is, correlates with appointment prices. London's down 7% on last year. There's a lower post-summer uptick, basically. That seems to be what's happening. So London isn't necessarily dropping off, but normally would pick up after the summer, and that isn't happening as it would normally on an annual basis, barring the sort of COVID disruption. Key variables being location of clinic and therefore demographic, price of your assessment, your sessions, and then the age of clinic. How long's that been there in that community? So I'm going to come back and unpack those a little more for my last few minutes. But first, let me make sure I toggle my polls properly, right? So I'm going to close that one. And I'm going to ask you, I'm going to try and narrow it down a little more, because those big three that I'm talking about were quite consistent. So of the big three, what concerns you most at the moment? Affordability for patients, running costs, staff pressures. Now, if you can't pick and you want to pick them all, you can click them all. I've set the poll, hopefully, so that you can select them all. So if you really, I want you sort of order a preference in a way, really. So if which of those is most concerning for you? But if you're totally torn, then yeah, you can select multiple answers. If you're copping out, if you're on the fence, I'd rather you didn't. But yeah, thank you for those that are participating. I can see that. I can see the bar charts going now. But yeah, please do contribute to that. It'd be really useful for us to know as to which of them, if you had to pick, gun to head, which of those are you picking? Let me unpack this slide a little more then. So insights from HMDG, our friends over in marketing, suggest that then if you've got a clinic in a more affluent area, then unfortunately for us, we can't tease out the variables between, say, price and location very easily, because it might well be that you've got a higher price point because you're in a location that can support that price point. But let's just say, for the sake of it now, that the location and price point is based on the fact that obvious affordability issue being that a patient that can and will pay 100 quid, is going to be less bothered about it affecting them because they've got more disposable income than someone that might be paying 40 quid for a session, and therefore may well be needing to consider tightening the belt, and that physio or any other care may be a luxury. That might be the difference between them being willing to wait 8 weeks on a waiting list or whatever it might be in their local NHS service. We know that those are factors as well, location-related factors affecting accessibility. You've got a really decent self-referred or FCP service in your area that you can drop into, that you know of, that's compatible with your work schedule, then you may well think, no, sod that, that's all right, I'll compromise there, if that's what they consider a compromise for a time. So that's why that demographic and location factor makes a difference. Now, what we can't know yet is it that it's in the price independent of location? Because that's another interesting variable. Is it that the price is such that two clinics in a similar location, same location, one's got a higher price point than the other? Is it then based on the fact that it matters less when your price is higher because of this perceived value that the patients and the local community has on that clinic? It's considered something that is an investment. I have not got the data for that. I haven't been able to tease that out. Going to be in constant communication to try and make sure we work that out, because that would be a useful insight for us all. Also, it's a bit early to tell for those of us, including myself, by the way. I've just put my prices up. It's too early to tell as to what impact that's had with regards to, has that meant that because we've put our prices up, but only for new patients coming in, new episodes of care. And so it's hard to tell as to whether or not that decreases new patient bookings, etc. But again, watch this space. We will get that to you. And when it comes to age of clinic, the interesting part of that is that it does seem to be that if there's a clinic there, it's been there 20 years, it's a staple within the community, it's well known, it's possibly the only one in that town that serves that community, it seems to be that they are a bit more stable, both for new patients and for general turnover. And so again, not easy things for us to toggle, by the way, which is interesting. And one of the things that I've been reflecting on, and why I'm really looking forward to it personally as to where this session goes, is then if it is that factors like this are affecting it, there's not a lot that we can do. You can monitor it and be mindful of it and plan cash flow accordingly. But where the primary sort of solutions are likely to be at this stage, whilst we're learning this, is going to be about how can we minimize running costs? How can we be shrewd? How can we potentially look at collective bargaining over stuff like that? How can we be groupish? Can we negotiate with suppliers and stuff like that? Which is definitely why I'm interested in this session going that way, as well as then tactically, how can we be deft in managing some of those staff pressures? Because your poll that I've just put up there has it pretty level pegging. Affordability for patients, slightly ahead of running costs, slightly ahead of staff pressures, but they're all pretty big and they intersect, of course, right? If we manage to understand and therefore not get hugely impacted by the affordability for patients and make sure our messaging and marketing is sharp enough for us to not have a massive drop off in income, we also keep our costs so that they don't skyrocket, then it means that there's just, cash is king. You've got a bit more to share about to decrease some of those staff pressures, as well as to take home yourselves this Christmas. The first one where we can consider ourselves really clear of COVID. Bearing in mind it may well rise back, which I know is something that will come up later, and I will bring up later if it doesn't, as to where people's heads are at with COVID. But hope that's been useful. That's just a few insights from me as part of my listening exercise, as well as bringing the listening exercise to this session, of which, of course, we will then be, I can't do it on the fly, but we'll be making sure this all gets put into the mixer and reflected on. Just making sure there weren't I think there is maybe perhaps a couple of other questions I have before I bring the panel in. That's one that I wanted to do. Let's have a look at that if you can. I'd just be interested. because I asked just to test the chat, didn't I, about where's your clinic based? But it'd be really interesting to understand the spread, because that's why, and also my geography is terrible. That's why I'm asking for a postcode. Is because my geography is terrible. At least your first 4 characters on your postcode. Because if you name a town I don't know, then I'll only end up having to put it into Google Maps. So I'd be fascinated to know where your clinic is based, because that could be helpful for us to understand where we're at with that. Thank you for those filling that in. Nice one. Someone's not put a postcode. I don't know if they've done that on purpose to dissent. I like you, whoever you are, from North Kent or Central London. Central London, various postcodes, I like saying. That's fair enough. But yeah, North Kent I know though, right? That's not, if you just said, it's when people give like a niche town that I feel guilty for not knowing where that is. But yeah, thank you. That's brilliant. I'm going to close that in 3, 2, 1. Sneaking any more answers in? No, let's close that off. Finally, from me for now, I had a question about the profile of your referral profile, I've called it. Now, so forgive the wording on this question, but let me just pull this poll up, right? I think it's one of the things that will come up a bit later. I don't think it's a primary part of this session, but what's the referral profile of your clinic? Is it all self-funding, all insurance, and I've got gradations in between? And that if you want to expand on that, then please do so in the chat. It'd be really interesting to understand that, because I think, and I'll give you a bit of a reflection myself, is that we are vast majority self-funding and kind of always have been. We see quite a few complex self-referral, complex second opinion type work from far and wide, and that's often self-funding, tertiary referral type stuff. But I know that by going that way, you then have a different market pressure than someone that is even Stevens or has a majority of insurance work. Not that one's better than the other, it's just that it's a different variable on the market, isn't it now? So that's one of the reasons that I thought it'd be smart for me to ask that and to try and understand where you're all at with it. And also try and understand where the sentiment is in this session. So again, really valuable. Thank you for contributing. Thanks. I can see you all voting away. My little bar charts are ticking over. So yeah, thank you so much for that. Okay, I'm going to close this in 3, 2, 1. Okay, poll closed. Fantastic. Right. So, as far as I can tell, we're up and running and the tech's working and no one's crying out for help for not being able to hear me, etc. And hopefully you can't hear me kids crying either. That's good. Ollie Coburn. Hi, Ollie. How are you doing? Customer confidence is not good. Lowest since the start of COVID, according to YouGov. Now, I can't open, or it's probably not wise for me to test my browser by opening that on my laptop. But customer confidence, consumer confidence, is that a macro thing across the board? Or is that something in healthcare or even closer? I don't know where that is. Maybe you can tell us. Helen said, it's great to have those marketing stats. They are just from one source, from a very specific demographic of websites. Wonder if we as MSKPN can collect our marketing data together. Yeah, absolutely. Of course. Yeah, that's always the problem. Similarly with my data when I'm going out on social media, is that's people that are following our work and that have those obvious biases that you can derive from that. So yeah, absolutely. As I said, if a researcher got hold of this stuff, they'd be mortified, and so we take it with a pinch of salt, sensibly. But yeah, that's always the difficulty we've got. That's what we're at, what we can access. So yeah, thank you for that. So hopefully we can press a few buttons, or well, they can. I'll let them try and do it first before I start interfering with their microphones and cameras. But I hope, if I have my slides, I'll go back to, you'll see my face a bit bigger, I'm afraid. And then hopefully I'll be joined by Karen Young, Rupert Crowfoot, and Natasha Price. Ru, how are you?
Yeah, good. Thank you, Jack. Very well. Very well.
Good to see you, mate. Good. So some interesting stuff come up already, I guess. You've seen some of that, but not all of it. But it's quite familiar. We've talked a bit about that recently, haven't we?
Yes. I mean, I don't think any of it's a surprise given the pressures we all face. But yeah, no, lots to get our teeth into tonight.
For sure. So Karen and Natasha also joining. I know that
I'm here, but my camera's not working as well. Sorry.
Karen's not behaving. That's such a shame that you've had to get me and Rupert rather than Karen and Natasha. That is not great at all. Karen, can you hear us? I've got her. She is there. I'm just going to toggle her mic and see. Karen, can you hear us?
I can hear you if you can hear me.
I've just toggled your mic on. I can hear you. Yeah. Are you going to, for bandwidth reasons, are you keeping your camera off as well? As we talked about that earlier.
Yes,
Yeah?
my
No
Wi-Fi is not compatible with my face.
No, no problem. No problem. Well, thank you for joining us. Unfortunately, I've not had Simon log in. I don't know if any of you have heard from him.
Yes, I thought he might have contacted you, Jack. I'm afraid he can't now make tonight, so I assumed he got hold of you. But sorry about that.
No, that's okay. No problem. I hadn't heard that, but no, that's fine. So I will. I'm going to hang around, but then similarly, just so that Rupert doesn't feel lonely on the screen. However, I will be taking quite the back seat, because what I want to invite you three to do really is to give reflections as to MSKPN, as well as your own individual businesses' take on this subject matter, as to how some of the problem solving that you've done can be then reflected. I'll come roaring back at the end to steer a discussion and to interrogate some of those ideas that you've come up with together. Does that sound okay?
Yeah.
Fantastic. For those that are in the Q&A, please use the Q&A function for direct questions for any individuals, so you can vote on that, and then the chat function for just as you are doing. Okay, but don't forget that Q&A function for search. Okie doke. Right then, so shall we kick it off? Karen, can you we'll do introductions first. Karen, could you introduce yourself to the audience?
My name's Karen Young. I have a clinic based in Scotland, up in Aberdeen. We have 3 clinics up in Aberdeen and Aberdeenshire. So I'm a slightly different demographic to some, but at least it's a different sense of perspective on things. So yeah, I'm here representing Scotland.
Fantastic. Natasha, just introduce yourself if you would.
Yeah, hi, I'm Natasha Price. I run a company called Central Health Physio, and we've got 3 sites across London. One's in central London and 2 are slightly outside of London, so they're all slightly behaving differently.
Interesting.
But yeah, lots to chat about.
For sure, thanks a lot. And Rupert?
Rupert Crowfoot. I run 6 Physio. We've got 9 clinics, 8 in central London and 1 in sunny Sussex.
Fantastic. So, yeah, Karen, you're quite right. That is a decent stretch between you and these Londoners, and obviously I can, where appropriate, bring. As I mentioned, if you weren't on the call just then, I have a clinic just south Manchester in a village just next door to Altrincham, and so I can bring that from the northwest perspective. But if we can kick off then, and any one of you can come in first, really, as to getting your general reflections on this subject matter, from either your individual perspectives as businesses, but also as MSKPN.
Shall I kick off? Tash from Central Health.
Go on, Tash.
Hi. So yeah, I mean, I think the problem is we don't really know how much energy is going to cost yet. I'm not sure everyone's been given their latest bills, but I certainly haven't. So on that side of things, it's tricky. Certainly with the cost of living, the biggest thing I'm seeing is the staff issue, and me feeling guilty that I'm not paying them enough, and them feeling frustrated they're not being paid enough to cover what's happening at the moment. So I think we all need to try and find ways to soften that blow and maybe offer different things that cost less to the company but mean more to them. I don't know if that's something that would be appealing to people listening, and very welcome to ideas on that front, because there is only a certain amount of money in the private sector, and if the money isn't coming in, it's difficult to work out how you manage that. And certainly from a patient point of view, I've been through a couple of recessions because I've been doing this for a while. And if you could see my face, unfortunately you can't, you'd know that. But before in 2008, when there was a bad recession, we actually did really well. So maybe, health does become a priority at this time. Despite the fact we're in London, we're more self-funding than insured. So I'm hoping that we'll have a similar effect this time, because I think people still break their arms, have bad backs. Sometimes these sort of things become a priority. So I think keep positive, because I I don't think it's going to be as bad as we perhaps think for us, even though we're a sector that, you know, relies on people coming to see us, and we're a service sector, but I think we're one service that people don't necessarily switch off. Those would be my thoughts.
Fantastic. That's interesting. Either of the other two you want to give your thoughts?
Yeah, I'm happy to follow on from that, if that's okay, Jack.
Yeah.
We, from an energy perspective, as Natasha quite rightly said, we don't know what it's going to cost, and I think that uncertainty is never good in business. You want to plan, you want to be in control. Especially, I mean, we're further north, our heating bills are potentially greater. We have looked at alternatives in terms of kind of solar panels, things like that we can put onto buildings, and grants. We've looked at grants that we could potentially get for that as well. But the numbers aren't really adding up for us at the moment, and the grants available are too great for the size of our business. Staff-wise, we've had a bit of noise as well from staff, and I think it's important. I think the one thing that costs nothing is listening, and it's listening to the pressures people are under, and I think they are concerned about the uncertainty and don't have the answers either. And I think they just really need to know that you actually care, and I think that's important. Things that we can do is for staff that travel. We've got some staff that travel quite a distance because we're more rural in some respects. So we take their days from 5 to 4, so that they've got then less travel and costs associated with that. Or if there's nursery costs associated with being at work, can we change hours to make their external costs less? So it's looking at their life and seeing if we can make work a little bit better for them, which then doesn't necessarily raise our costs either. We certainly up in Scotland, they are potentially striking for a 10% pay rise in the NHS and staff wages, which is a bit of a gulp for us to try and keep up with some of that. But hence it's looking at the free stuff at the moment. We too have been through a recession, and we've been through the oil downturn up with us, which had significant effect on our community. And like Natasha, our business did well. We stayed really quite strong through that. We didn't see the downturn that we expected. And this is maybe going to sound a bit soft in this, but I think people do prioritise health. And I think if you can show you care and you're linked with that community and trying to do community things that kind of show people that you're there for them and to care for them and listen to them, always helps with trust from patients. And I think they need to know that they can trust that you're actually after helping them and helping them to get better rather than after their cash. And I think if that message is clear, then we've always done pretty well with making sure that is what we're firstly trying to do. The other thing is looking at reducing outgoings. So Rupert and Simon have met, with Eureka, Physio Care and Bates to look at trying to get MSKPN discounts. And we've kind of reviewed on the back of that some of our outgoings and managed to make quite significant savings on the back of that. So I think it's always looking for a deal. Maybe that's the Scot in me, but trying to see if I can cut costs in places where I can cut costs. So yeah, that would be my main things.
Thank you very much. And Rupert.
Yeah, and Jack, if I can just pick up on that bills piece from Karen, in terms of what we can do collectively as a trade association, we are absolutely going after some things where we can pool our collective buying power and getting discounts. So I don't want to sound into sales pitch, but the two deals we've got with Bates and with Eureka, they're a 10% rebate that gets applied to the member's own account, and it's if you're spending more than $3,000 a year on consumables, supplies, stationery and stuff for your business, which is not a huge sum of money, so I'm sure a lot of people are spending that much and probably a lot more, that 10% rebate alone will pay for this year's membership fee. So you know, there are things we can do, and we're chasing more of those as well. So, you know, I hope in the next few months, you know, we'll introduce more benefits for members, which is just going to help save all of our businesses money, because collectively that is one thing we can do. So we're looking at office software licensing, so both Microsoft and Google stuff. We're looking at some of the insurance products, because we all need insurance, whether that be public liability or medical insurance. So we're looking hard at that, talking to a number of people to see what we can do. And we're also looking at the software products as well and providers, because let's be honest, there's, you know, a growing cohort of us who all use the same software and same software providers. If we were one big company, we'd get a better deal, and we are already knocking on their doors to see what they can do. And you know, if we can give back that way, it's just really simple, really easy, and helps us all be more successful. That's got to be a good thing. And I think, you know, for me, to some degree, MSKPN got going during the pandemic. In fact, we had our famous launch party. I think it was in January, back end of January 2020. And about a month later, you know, all hell broke loose, didn't it, as we all know. And I think the lovely thing that I saw, I think we all saw, was a whole load of us all coming together to say, shit, you know, what can we do? How can we all help each other to stay afloat? And, you know, if we can keep that spirit going within the trade association, and if we can grow and more members can join, you know, we can do more things. I'm absolutely confident of that. And I think, you know, moving on to the other points around patients and Bill and people, I think, you know, we've had a rough few years. Everybody's had a rough few years. I've certainly lived through a period of time where inflation has been very high. I can still remember the day that inflation rates went up. Well, bank rates went up to 15% overnight. So at the moment they're creeping up quite fast, but I saw them go up over 15% in literally overnight. And it is tough running a business when you've got inflation, because it creeps up on you. And, you know, eats away at the little margin you've got and puts huge pressure on you as a business. So I would just say, you know, if you haven't started taking action yet because you haven't seen much impact yet, it's coming, it's here already. And you do need to really look hard and get your microscope out and look at everything you're doing and everything that you're spending to see where you can save. And with patients, I think it's interesting, and affordability, I don't want to sound glib, because it's going to be, you know, we're all going to find the cost of living tough. There's absolutely no doubt about it. But I'd be a little bit maybe controversial and say, I think in terms of affordability, I think sometimes as a profession, physios don't always value enough what they do. And I do sometimes see and observe as a third party looking in. I think we sometimes make our own minds about what patients can and can't afford, and I think we end up in a place where we're assuming that they can't afford it. So we try and do something different, or we say, off you go. You know, that's all we can do. And I think we should value what physios should value more what they do, and should, I guess, also not make assumptions about what patients can and can't afford. And our experience actually during the last kind of downturn in 2008 was actually very similar to Karen's and Tash's, and that was, we didn't see a massive impact. And I'm not, again, being complacent, because I think it's going to be tough, but I do think, you know, if I was a retail, hospitality or leisure business, there's some discretionary spend in there. You know, I've got a decision about whether I order pizzas in tonight, or I go out for a meal, or I take my family away on holiday for a weekend, or go to a hotel and stuff. And if times are tough, I'm going to cut back on those things, including all those early morning coffees I have. I do think patients will prioritise other things, and we have to hope that continues to be the case.
Karen reflected last week about and spelt out some of the savings that she'd made, and she's just repeated that there publicly with Eureka. I was so surprised on 2 counts. Turned out I was overpaid anyway. I'm like embarrassing that I hadn't looked at that for 12 months or so, and that does then. It's one of them where really you should be refreshing it. Like at home, I'd got into better habits with, say, energy or internet or whatever. But in consumables, I'd taken my eye off the ball. I think I was overpaying it anyway. So then to get the treat of going somewhere that was better anyway, and then the 10% rebate is going to be a real game changer for me. So certainly for those that haven't looked into it, then please do have a look at Eureka. And of course, if you're not already an MSKPN member, then another good reason to be one. But also, what the other points that you're making there, Rupert, the different I offered a reflection earlier about how, of the three, at the moment, because it's a bit unknown as to the affordability piece, and then how exactly much we've got to share out is the staff bit. Would you say we would be smart to prioritise, get that spreadsheet out and start working out how we can sharpen our pencils on that? Is that where you feel we should prioritise?
Oh, 100%. I mean, it's right under your nose. You just need to get the microscope out and have a look at it all. And I do think, you need to think hard about what you prioritise. There'll be some things where you chop too hard and you detract from the service, the proposition, and the value you bring for patients. So again, and I think it was interesting with the ethical, the kind of green stuff. Some of those things are patients not thank us for chopping, because they perhaps come to us because they like what we stand for, what we're doing is about your values, your proposition. You just need to think about everything in the context of how you want to be seen by other people, and by patients, by consumers, by your staff too as well, who might not thank you for chopping that little bit over there. It might save you a few quid, but it might cost you more in the long term. So I don't think, it's always necessarily an obvious list. We'll just ditch all the green stuff, which, is what a lot of politicians are saying right now. Well, let's just forget about the environment. Screw it. Let's just, drill for more oil and, let's start digging up coal again and burning it, because we've got a problem. So do think about it in that context of who you are, what you want to stand for, and how you want to be perceived, because there may be more value in sticking with those things, even though they're a little bit more expensive.
That's it. And those two things that were either side of it on point 1 and point 3 is that the staff and the community will have a memory of that. If it was a brief thing, but you did end up completely selling yourself out for a period of time as a means, you're unfortunately likely to look desperate, no matter how best you communicate that. Karen, could I just bring you in a little bit on some of the staffing piece? Where is there? Have you had any reflections on, or what is your model with regards to the difference between, say, salaries and associate? Does that make a difference? Are there different, say, pressures or likelihood of those conversations being more or less different depending on a staff model?
Most of our staff are salaried now. We have very little associates. So most of our kind of conversations come from staff. I think with regards to both of them, though, I reiterate that listening piece. And we found following COVID, we did far more kind of one-to-one discussions with staff rather than team discussions. Because we couldn't get together as a team, but we've actually found coming out the other side of it, the importance of that one-to-one discussions. And I think people can then feel that they can voice their views, their concerns. And I had one staff member the other day that said, "Oh gosh, I just feel so much better having actually discussed that with you." So I think it's not to get bogged down in the nitty-gritty as a business owner, because you can't, but it's also to make sure that they do feel that they're listened to and their concerns they can bring to the table. And we can't fix the world, but it's trying to make sure that we can listen and fix the fixable.
Yeah, that makes sense. And certainly there's such a difference between you raising that conversation, inviting that conversation, and it being something reactive and trying to kick that can down the road. And so I certainly encourage anyone listening to give that a whirl, even if it's difficult, even if it's rather irritatingly close to the last time you had to have that conversation, maybe with someone or with the group. Natasha, your thoughts on that broadly, if I can, as well, on staff?
I think I completely agree. In fact, that's reminded me to spend more time doing one-to-ones with staff, because you do get bogged down in what you're doing, and we've had 3 years of nonsense, and your statistics on London, I would say, are fairly under what they should be. I think London is definitely more than 5% down. So there's quite a lot of pressure, and I'm sure it's the same across cities across the country where people are not in the offices as much. So that does restrict what you can do. So as a business owner, you get slightly bogged down in that. So I think spending more time with people, and there are easy gains, not easy, it's not the right word, but simpler things that you can do by listening to people. I think the childcare piece is very important, but also just offering them other things that cost you less as a business. So we were trying to work out today what we could do that would do we give people a day off for their birthday, or do we give them, it's just some different things that might be more palatable as a business owner, and a nice thing to do for the staff as well, that will keep them engaged. But yeah, I mean, it's a difficult time, but I still do reiterate that health will often be a priority for people. So let's hope that's true.
Yeah, helping, because it's one of the things that we always want to, we're passionate about promoting health as an investment, because we know the evidence, the data, and the experiences that we've had with so many people turning their lives around on a daily basis over this stuff, and rehabilitation, scaling their abilities so they can live a more fulfilled life. We know this. We don't need preach to the choir necessarily, but we need to make sure that that is throughout and consistent in any messaging. And that involves 3 layers, I argue, one of which is individually as businesses. Then there's this network piece that we're trying to achieve, of course, through MSKPN, but more broadly as professions, as an industry, we need to be speaking loudly and proudly about that. And then there's that third level as to how we're necessarily seen then in beyond in those contexts with regards to policy in Parliament or the media. It's kind of all those lines get blurred, but we need to try and make sure we're finding ways to be consistent over it being an appropriate investment. I think one of the things that I was wondering if I can I ask the audience in a way is that we haven't got naturally, because we've only got a panel of 4. We haven't got a massive spread, a demographic spread. Whereas when you put your postcodes up, even at a glance, there's some decent spread. So if I can ask the chat, if for those of you that have got your hands on your phones or on your laptop, can you give me some reflections on what you felt about my points on location, that mattered, and that price point mattered? Because the data that we have, and also the conversations that we'd had were reflective of that, is that rural Doncaster had a different take than, say, even city centre Bristol. Or other factors such as that were to do with, say, price point and location. So I would just love it if I could just get any of your thoughts, if you're willing, on the chat. That would be useful. And another point, I suppose I want to invite, actually, whilst you're answering that, if you don't mind, if you can just give me your thoughts on that on the chat as to where it is you guys are, and how relevant do you feel that is to the circumstances you find yourself in, or how relevant do you think it's likely to be, basically, throwing back to history if you can. But Rupert, if I can ask you about COVID, do you think that is something you mentioned about MSKPN being born into it, to some degree, therefore well au fait with how those variables do and don't affect business? What's your take on whether that might either come roaring back as a disease, whether that will have literal policy implications, or how might we best manage that in terms of, say, staff and things as well? So I just wonder if I can just bring in the C word.
Oh, I want to put it behind. I don't want to talk about it anymore.
Sorry, just a quick, only a few minutes.
Do we have to talk about
that? Oh, I guess it's going to bubble around in the background, isn't it? I mean, even this year we've had some drag from that as things have popped up. We work in a healthcare setting, so when members of staff get it, you clearly don't want them in the clinic. There will be some patients who feel uncomfortable with that. So it's going to be around. I think it's going to sit around in the background. I think all of these challenges we're facing, by the way, will come to the fore. I'm done with predictions, by the way, because the last 2 years, anybody who's predicted anything has proved to be wrong by several degrees, haven't they? So, whether we'll get hit by something else, something new. We all thought it might be monkeypox a few months back, didn't we? It's not turned out to be the case, I don't think, but who knows? So I don't know. I think we're in I think we know how to cope with it and live with it. And I think the good news is, we've remained open as businesses throughout the last few times. It'll just be it'll slow us down a little bit if it rears its head again badly this winter, or beyond this, a new pandemic, a new something, and call it whatever you like. We're bound to get a few more, aren't we? Given the way we live, the way we're interconnected in the world, the way these things can flare up somewhere in the middle of nowhere and beyond our shores, just because people are travelling and moving as they do. And we're destroying the environment, aren't we? Which isn't helping, apparently. So, all those factors are conspiring that we'll get more of it. Yeah.
Karen, any thoughts, or are you like the rest of us wanting to hide from the C word?
Well, I think being a bit further north, we're still in masks up here, so we're a little further behind. One of the things I think Helen brought up today on the chat was about the COVID cancellations. And I certainly know our kind of self-employed staff certainly speak more about what are we doing about it? Are we charging people for cancelling? If they're saying they've got COVID, and it's really difficult. And it's, I would welcome others' views on this, but our feeling is if they do have COVID, and the trouble is you've got no way of proving or disproving that they do or don't have COVID, we don't want them in clinic. So the trouble is if we end up charging people for cancelling, or they feel they have to come in because we're going to charge them, then potentially the ramifications of that are greater than the loss of one appointment if a member of staff or most of the staff group have to then be off sick. So I think it's a challenge for us, particularly around about Christmas, because if they've got a party and are not feeling well, are people going to phone up and say I've got COVID to waiver a cancellation fee? I don't know, but I do think that will be a challenge, and also for staff affording to be off sick as well.
Gotcha. Yeah, anything to add to that, Natasha?
No, not really. I think COVID's a bit difficult, test or not to test, declare or not declare. It's very difficult. So no, sure. I think we're just hoping that it's reduced and it will continue that way, but who knows what will happen in the winter. Yeah,
absolutely. I think it's that we're going to drive towards action in a second, so I might throw that in there. But thank you for those that have posted answers to my question regarding your locations and how that was affecting you. Thank you to Rachel, saying that she's in an affluent area in Northern Ireland. I haven't noticed a downturn as of yet, but I've noticed more people coming in with health insurance as opposed to paying privately. She feels this might be a sign that more people are signing up to private insurance as they realise the NHS isn't going to be able to carry on the way it is. We've noticed something similar to that. However, it's more that they've kind of jumped to self-paying. So people that would have otherwise, accessed the NHS, relatively low waiting list round us historically on certain services, and a decent variable FCP service has meant that then they have had access. But as the NHS has ended up being under strain, they have found themselves then just self-paying. We've not noticed that in between step over people then self-insuring, or they're deciding to sort of insure by being sort of members with us. Steve Canning said his main clinic is an affluent residential area with increased prices early 22, and feel private patients are largely happy to pay this. There's been a slight quieting of the clinic with PPs recently. PPs, private, what was that? Help me out with this acronym, sorry, Steve. Or
private patients.
Private patients. There's been a slight quieting with the clinic with, I don't know if that's, I wonder if that means insurers, or it would make sense in the sentence. Sorry, Steve. We get a few patients, often returners, coming in for 1 to 2 sessions when previously they might have come back a little more. Yeah, that's going to be interesting. Is the consumer behaviour of amount of sessions, say, or the completeness and thoroughness? Are people going to sort of get 60% there and then bail and suck it and see, when they might have been a bit more thorough, might be a bit less persuadable to see that tendinopathy all the way there, perhaps. And also, I think one of the things I've noticed is that staff might be tempted to start to dabble with gentle remote management. I always want to encourage self-management, but it's just that then if they start then discharging people early for various reasons, but then still monitoring them from afar and taking up quite a lot of time on the phone or emails, then that does defy the point and could compromise the service in a number of ways, including the patient care is going to be compromised by that half-assed approach. And so I noticed that sometimes can creep in anyway, different people and different circumstances. But in this case, it might be a more general pressure. So that's something that I've noticed to monitor. Yeah, sorry, Steve. He has clarified he meant private patients. Yeah. Was there anyone else on this? Jane had said location will be a main thing, but more affluent areas come with much higher running costs and higher costs of living for staff. Absolutely. So it swings and roundabouts with that. It's not as if the price point on the sessions isn't relevant to the fact that the overhead's often higher especially in city centres. Joe Turner said, speaking from the COVID experience, I would add, don't be afraid to ask your staff for their thoughts and allow them to help. Generally, people want to help. I think that's true, especially with the COVID stuff. That has implications, doesn't it? If you're creating, say, COVID-specific policies on cancellations and the like, or particularly staff coming to work when they've got COVID. That was one thing that I heard from people when I was doing the listening exercises, that they had staff that then were, there's no legal reason why they can't come to work now, and said, well, I'm willing to wear a mask. And then the clinic was saying, whose obligation is it to tell the patients? Is it the clinic itself, or I think it was an associate? So that was quite a complex one, and these get into quite a lot of detail. So Helen's asked, could I put a poll up to ask if people are charging for COVID cancellations? We don't, but I know clinics that do charge for all cancellations. Trying to work out next steps on this. Kate Montgomery said she charges £25 late cancellation fee, stating that we're sorry that they're poorly, but we too have overheads to cover. Right. Well, whenever I bring in, I'm going to ask a question of these three, and while they're answering it, Helen, I will pull that very poll up, no problem. But I just need a second. So, my question for the three of you, as we drive towards tangible actions, Rupert, I'm going to go with you first. You've mentioned some of them already, but what is it then that you feel MSKPN and the wider MSK community can do on collectives? You can reiterate if you like about some of those sort of discounts and things, but also any other ideas you've had as to what we can do together to drive things forward.
Yeah, sure. So yes, absolutely. I think foremost and most immediate is the cost saving piece. So, these are rebates that get applied to your accounts when you purchase stuff. You're going to see that impact straight away on your bottom line, which is fabulous. I think, the next one's probably a longer term game, just in terms of trying to raise the bar in terms of quality. This really plays out to the insurance marketplace. I would just say as well, this is everybody's decision to do what they need to do for their business. But, we've increased our prices. I've gone to all the intermediaries and insurers and also said, I need to raise my prices and put forward a proposal. Now, I'm not expecting them all to turn around and say, fabulous, not a problem, here you go. But I think we do have to wave the flag. We do have to say, we're seeing these price pressures, because they're all seeing it. And everybody I've had a conversation with so far understands and gets it. How much action we see and how much change we see, it is difficult. And I appreciate everybody's in different boats. I know there'll be plenty of people who will struggle to get access to the right people to have a sensible conversation and may be frustrated, with those conversations. But we have to say where we are. We have to be clear with people, the pressures we're under, because we are part of, we're part of their ecosystem. If it's an insurer, we are providing care for their clients, and without us, they don't have a network. They can't deliver what they promise to deliver to their patients. So, we talk about stakeholders. They're stakeholders in our business, and we're stakeholders in theirs. And we've got to raise the flag. I think longer term, the game has to be around changing the way those insurers commission their services, and it can't just be about the numbers of sessions and a fee for service. And all I can say on that is it's going to take some time to get there, but we are moving in the right direction. I don't think there's an insurer out there who we haven't spoken to who understands and recognises the current commissioning model is broken and is not working for them or for us. So that's the good news. It's then about starting to shift and change in a different direction. And I'm afraid, we're going to have to demonstrate the value of what we do. That's got to be the outcome work that we're doing. And we can pull that, we can show what good looks like, and then we can move things forward in a different direction. That's not going to help us in the very immediate future, but it is a longer term play. And I think will make the industry much more sustainable for us all, and allow us to make some money to reinvest in services, reinvest in staff, reinvest in training and technology and all sorts of things. That's I think another reason for being part of MSKPN, and is the sole reason behind our existence in the first place.
Well, collaboration over competition at a surprising and alarming rate. I remember when I first heard the idea and stuff, and I was just like, well, of course it's a spirited plan, but it just seemed like it wasn't likely. I was wrongly too cynical about it. But then the more I thought about it, and the more I've seen it in action, it has been compelling. Karen, can I bring you in on some examples, if you would, about that? What is it about then being able to pool ideas in this instance? So we understand, and we can definitely, I'm not trying to undermine the pooling resource and being able to then get collective bargaining, but we've talked a bit about that. In this case, I want to think about how organizations or small clinics that might otherwise have seen themselves in contrast or competition, that are then collaborating and pooling ideas. Can you give me examples of how that raises standards in the network?
I think there's, I mean, do we really have any secrets? I mean, I think we're all striving for the same thing, aren't we? And I think there's some good business practices that we can share, because a lot of us, I'll maybe take Rupert out of this because he is he is a businessman and he knows the business world, but a lot of us are physios that are playing in business, as in we had a passion to start a clinic to help people to work in private practice, but we actually, I mean, I've had no business training. I'm making it up as I go along over the last 20 plus years. So to actually share ideas and expertise and experience from people, or from people more like, kind of Rupert, who actually does know what he's doing, from that perspective. I'm not saying people don't know.
Does he?
Obviously I do as well, Natasha, but I kind of, we've often fallen into this, we don't have a kind of degree in kind of business, and it's been able to share these kind of business ideas together, I think is really important. And it was in COVID, it was the whole kind of cash flow forecasting, the kind of the spreadsheets and how to do that. And, here's a spreadsheet that you can do to kind of look at your cash flow, where you're at now, and forecast it. That was really valuable for us as a kind of smaller business to look at. Okay, we can't control any of this, but maybe we can actually have a better visual at our business to make sure there's less surprises. So it's things like that which are really important. I also think to discuss the main themes that are important to us. So marketing, for instance, was something that came up on the chat, about different ideas and things to do, because although you're looking at marketing, well, that's maybe where we don't want to spend money at the moment, unless you're driving business in, you're going nowhere. But how can we do that and share ideas of things which has worked for people, that has worked or that hasn't worked, so that we don't end up wasting money on the wrong things. And that was certainly put forward as a webinar, and maybe that's something that we can do to kind of share ideas and take that together. The whole kind of private health piece as well, having been more involved with the kind of directors, it's looking at the work that is happening behind the scenes with the likes of AXA and Bupa. And I know I'm kind of going with Simon in November to kind of on the AXA call. And I guess if there is things which are kind of pertinent to members that, would like to take forward, then, we can do that as well, so that there's a real voice for the members within MSKPN. And I think, good physio is never bad for business. That's a phrase that people speak about. And Rupert also spoke about the fact that we shouldn't underestimate the value that we put on ourselves. You don't take your car into the garage and they tell you, by the way, you need new brakes, but maybe, don't bother, try and fix it yourself. They will give you a cost for that, and then you decide what you want. And I think it's about giving our patients the choice, not making that decisions for them. It's okay, I'll give you everything in one session and off you go. Maybe they don't want that. And it's, putting it on the table, what we can offer, and then having that discussion with them about what they want. But, look at the garages, that's a car, it's not your health. And they don't give us nearly the same informed choice. It's, this is the bill, and are you paying it if you want your car back? And I think we need to value far more than what we actually do. But as a group, we can certainly come together and discuss these things and problem solve it together, because we've all got different experiences, we've all got different takes on things, and I think it's together we can help try and make an impact on this industry.
Absolutely. I think one of the things that's interesting as well is that unlike a garage, we are actively getting the patients to participate in their own recovery in such a way that that relationship depth is improved. It is a sort of sales and marketing dream that you will have that relationship and depth and trust that is based not on smoke and mirrors, but on genuine appreciation of shared expertise, as well as the collaboration that modern MSK practice involves. You know, it isn't something being done to people; it's with people collaborating towards their functional goals. And so we've got to lean into the fact that that is a decent way of building that ability to be frank and honest about what it would take and what it would cost to recover. I have put those polls together. I've put them in two parts, actually. I want to know, do you charge for cancellations generally? But bearing in mind that the next question is, do you charge for cancellations if the patient has COVID? So I'm going to put them as two separate polls because I'm interested. Yeah, Helen Preston backseat driving this, so sorry for not putting the polls up ahead of time. Helen, if you've any other suggestions for polls, then please do let me know. And if anyone else does, of course, that's something I can do on the fly on this technology. So yeah, do you charge for cancellations? If you wish to add detail, if there's a nuance to that, then please put that in the chat. Really keen to know, you know, if so, what is that a percentage of your total? Is it that you do a prepayment as standard and therefore only and then refund them half of it? How do you play it? I'm intrigued by that, but it's smart for you to put that in the chat rather than on, obviously, for me to make a list on polls. I'm going to close that one in 3, 2, 1. Okay, so my next one on that then was, do you charge for cancellations if the patient has COVID? Start poll. So yeah, I'm intrigued by this one. I just thought it was smart for me to separate that off because that might be that people have. I've known that people have got a cancellation policy, but then they waive it for COVID. Personally, we've just updated our cancellation policy because we're doing prepayment as standard. Oh. And I'm back. Sorry about that.
Thank goodness for that.
I'm okay. Drama. I'm all right. Sorry about that. Probably woken the kids up now. A bit of comedy for you. Right,
what happened?
What happened? I'm too fat for this chair. That's what happened. No, I was doing as my teachers always told me not to. I was swinging on my chair, so I was leaning forward. It's just slipped from under me. So sorry about that. You know, if I had the capacity for embarrassment, I'd be embarrassed now. Do you charge for COVID cancellations if the patient has COVID? I'm going to close that poll, but I can tell you now, because it's not hard for me to do the maths, all of you have said no. No one does. That's interesting. So let me go back and find the other poll, because half and half, pretty much, so most people have a cancellation policy in which they do charge for cancellations, but clearly there's an exemption for COVID for all of you. So that's interesting. It makes me wonder and reflect on my own new policy. So yeah, thank you so much for that. Obviously, we will share these out. We'll put it together as a bit of a report, but obviously be sharing and reflecting on that as carefully as we can. Joe Turner, lovely and cheeky question come up there. Have I been cutting costs on office furniture? Fantastic, thank you for that. No, I can't blame the chair for that one. No, it wasn't that. Right, so Rachel said we officially say we charge, but generally don't if they rebook. Okay, that makes sense. Steve said, similar to Rupert, we don't charge cancellation of DNA on first occasion in most cases. Yeah, leniency on first instance. I'm interested if you can on the chat as well. How does this play out for you guys with regards to, say, DNA? Anyone else doing sort of prepay? So they've always got something on file. We've gone to that. I've always had that with my dentist. It's never been a problem, and so we're now getting people paying as they book and then paying ahead for whatever session it is they're booking. Is anyone else doing that? Maybe that might be more standard practice than I know of, but we're moving towards that as a model from now, which means then you've always, if they're cancelling, you've already got their money on record. We also have it as a cancellation at 24 hours, so I'd be interested in how anyone else is doing that. one question that I wanted to put to you guys is certainly about then what the future might hold with regards to the different ways in which we can support each other, and how MSKPN intends to do that. One of the primary concerns I know I had initially, it's been mitigated from conversation, but is that there are such variable sizes to some degree within the network, in such a way that then if it starts to get, is the spirit of collaboration going to fall away and the dog eat dog return? If we is there a risk of that? And if not, then how are we going to make sure that spirit of collaboration does stay consistent, and that this isn't a wolf in sheep's clothing as an organisation that could undermine small business? So I know,
Jack, can I answer that?
Please.
So yeah, I'm not a small business, but I'm not a large one like Six or Pure, who are also on the board. There's no way a dog eat dog approach to this. These are some of the Pure and Sport were the biggest players in London. They want to help. There's a genuine, willingness to help people. And so there's a question on here from Angela Schott about getting together about the insurance companies. That's exactly what we're trying to do with MSKPN. The insurance companies will tell you there's a different price point and other companies are happy with that price. That's not quite true. And as a group, we can do that more easily. We've got another poll going out there. Sorry, distracted me. But I think it's definitely not. That's not what we're trying to be. We're trying to be a supportive group that work together for the same end goals, really. And I think we've proven that in the last few years anyway. And I would really want to help smaller, younger practices who are coming up with the same problems that we've come up with in the past, like knowing we've been through a recession before, for example. So it's definitely not what we're trying to be. It's definitely a collaborative, helpful. The better quality that we have in all physio practices, the better it is for all of us. So that's absolutely the message we want to give out, for sure.
Can I jump in there too, Jack? I mean, I think to add to what Tasha said, that's absolutely true. Because Simon and I, he runs Pure Sports, I run Six. People are often amazed what you sit on the same board, you talk to each other, you share information, you do stuff. It benefits all of our businesses if we raise everything up. There's absolutely no doubt about that in my mind. But I think I'd also say, who's our competition here today? The competition in my mind is not necessarily other physios. It's chiropractors, it's osteopaths, it's medication. It's GPs who are prescribing pills and painkillers to people, and they're getting hooked on them, and that's their life. And I think we need to just think about who's the competition here in a different way, because it's not necessarily the physio practice around the corner. I think our experience has been every time we've opened up somewhere, there's always been a whole plethora of other people around, and I think there's lots of work for everybody. There's lots more we can do, and we can only do that if we're all successful. And I think there is an element of collaboration.
Just a risk of me sounding pedantic, but we are a multidisciplinary network. And I know what Rupert's meaning, though, is that he's meaning that a different model of care. So those that are dishing out quick fixes or implying a non-rehabilitation model of care that isn't contemporary, then that would be an obvious contrast to the network, rather than it being just those disciplines, of which, of course, we have esteemed members of say, osteopaths and chiropractors within our midst. But just to clarify that, rather than disagree, of course. Karen, your thoughts generally, because one of the things that being as you're saying, more rural and up in Scotland, it's something that I wondered if it might be London centric, it might be England centric, and things, because of the fact that we might have ended up in the weeds on, say, policies or the nuances culturally. Is it something that therefore the messages and the collaboration that then travels, including across sort of borders, and doesn't matter so much on the detail?
Absolutely, and I think the thing which is at the core, I think, of MSKPN is about that quality agenda, and how do we help prove quality, and how do we ensure good physio? Because when we're having discussions with the private health insurance companies, it's about proving our worth, proving that we make a difference to people, and it's how we actually go about that. So as a physio, I'm passionate about the profession, and I'm passionate about trying to move the profession forward. And I think at the heart of MSKPN is that it's about quality. And it's about, if we can prove that quality is there and that we're all doing a good job, then we have far more bargaining as a good quality profession, as opposed to, if we can prove the quality. I'm gonna rabble on there a little bit otherwise. And I think the issues and having discussions with kind of people around the country, that the problems that people are facing in London, not so much with the lack of people in central London, because we've still got the same people rurally, but the cost of living is still great. It's still an issue for us. The staff retention, where you get physios from, is still an issue for us. Trying to make sure we can make a living out of this is still the same for us. Rent rates, all these factors are still pertinent for us. So those things don't really change geographically. There's just some of the smaller factors.
Some of the work that I think I can see taking shape with the internal discussions as well, which we haven't obviously got conclusions of, but as each of us start to pursue options for energy, different tariffs, who's got roofs that would fit solar panels and be appropriate for them, these sorts of things are best served as a group, because it's so inefficient to have to do all of that work yourselves. And so having a few people looking into that with energy tariffs and understanding that as best we can, whilst the others then look at who's going to hustle Virgin or Sky or TalkTalk, these things are best done together. And within a network that is trusted. I'm really excited for what we could achieve, both in times of trouble, but also then what it looks like for some of the more sunny and optimistic side of growing our reputation in the industry, as we did have great moments of, even in the depths of the pandemic, through some collective PR work. So really excited for that, and really appreciative of what you're all doing. Rupert, if I can get your final thoughts, please, before I sort of sum up and call to action for those that are foolish enough to not yet be members.
Oh, listen, we need to get a little bit bigger. I think when we're a little bit bigger, we've got a few more members, we can just do more. And I think, at the moment, part of our frustration is we don't always have the resources we would like to do more. The directors like myself, Karen, Tash, Simon, and Joe, give their time freely and critically for free, because we all believe in this mission. And it's a simple one. I think when we first started talking about things amongst ourselves, what became really clear was that the challenges were the same for all of us in all of our businesses, and that the direction of travel we felt as an industry wasn't great, and we could see where it would end up in not a brilliant place for us all. So we wanted to do something about it, and that's why MSKPN exists. And the more of us that work together, the more we can achieve together. It's as simple as that.
Yeah, absolutely. In the spirit of that, the Physio Matters and Therapy Live, we've been really quite conscious about producing content and thinking of events that are less disruptive to people's work days, and certainly to employers that don't then necessarily have to have this dilemma of what might we fund, what might we be able to give days to. So we're going to be doing evenings and doing smaller tidbits, but that's partly because we've got this massive library now, of which people then use as their CPD access. And so we're going to be putting forward an MSKPN exclusive discount for that, for library services, so that CPD, both in terms of events and courses, as well as access to what is the world's biggest CPD library in our industry, will then be an exclusive discount for MSKPN members, so that then we can help that. We know that those costs aggregate in businesses, and that those pressures can mean that then the wrong course or the right course or conference can then attract 2 or 3 that want to go together in the same car, that then mean that you get a massive void in your business on a Thursday, Friday. We are your friends in kind for that. We want that. We've got their best interests at heart in trying to raise their own clinical standards, but also that needs not to be at the expense of the industry in these difficult times. So in the spirit of that, Physio Matters and Therapy Lab will be putting in some of that discount and some of those exclusive benefits in for MSKPN, because that's the sort of thing that will make a difference. So we're being thoughtful so that good ideas don't then also have a trade-off on the industry, and that's what we're going to be working towards. So just another thing, just to throw in there, click the banners and links around. As well as them, please do tell all your friends. We will be putting this recording up and making that available. And so for those that weren't able to attend, we'll be able to send that over to them, but also for you to be able to share that amongst your friends and acquaintances to say that this conversation is ongoing. Of course, we weren't going to be able to solve the problem today, but I hope the spirit of conversation and collaboration can come through, and that we can work on how we can, as a collective, do more than the sum of our parts. And so thank you so much all for joining. Really appreciate it. My final poll of the evening is one of which I want you to be as honest as possible, and I promise you this is something that is super important for me and my team, as well as for MSKPN when considering the format of these sorts of sessions, as to how highly you would rate this. How useful has it been? You have lent us an hour and a half of your time and contributed brilliantly to this conversation, and we value your time. And so please do let us know how you rate it. And also, if you have any feedback, even if that wants to be after the fact on email or any other format that you want to get that to us, then please do not be shy to let us know how this has been and how worthwhile it has been, because we absolutely do want to practice what we preach. We don't want to be hypocrites. We value your time. Time is money. You could have been seeing patients. You could have been grilling a new policy, as boring as that might have been, but instead you spent it with us, and I hope it has been useful for all of you. Thank you for being a wonderful audience. Thank you to Rupert, Karen, and Natasha. It is absolutely gutting to me that you had to tolerate mine and Rupert's faces and not theirs. But we'll work
Sorry about that.
We'll work on that next time. But the text tends to have generally held up when we didn't strain the bandwidth with the extra videos. So there has been some reward. But that's it. That's enough from me. And yeah, thank you for everyone filling that poll. And let's make sure I close that off and take the right photos of that before we finish. But it seems to have been well regarded. If there's anyone that's got any constructive feedback as to what you'd have preferred or what you were hoping for, then please, again, don't be shy. The whole purpose of this and the whole point of the whole project is that we've all got thick skin and we're trying to critique and understand each other better. And so there's absolutely nothing wrong with that if you do have anything that you want to refine or any suggestions for future sessions. All the best then, and take care. Have a lovely evening. We'll speak to you soon.
Thanks, Jack. Thanks, everyone.
Thank you.
Thanks, Jack.
Bye.